So, hello students. Today's topic about gram stain. Okay, so gram stain that is very important for exam point, practical exam point of view actually. So, gram stain is differential type of staining. Why is it called differential type of staining? Because it differentiate bacteria into two category, that is gram positive bacteria and gram negative bacteria. So these are the different reagent. You can see crystal violet, that is act as a primary dye. Crystal, remember one thing, crystal violet is act as a primary dye. The next reagent is grams iodine, it act as a moderant. Moderant means it fix this color of this dye. Then ethyl alcohol or acetone, it is act as a dechlorizer. And saffronin, it is act as a counter stain. Counter stain means it is re-stain this bacteria, that is decolorized by this ethyl alcohol or acetone. So before proceeding with gram stain, okay, what are the things that require for this gram stains? So first thing is that we require bacterial colony. Bacterial colony are isolated on culture media. Then next step, one drop of normal saline. NS stand for normal saline, is put it on this glass slide. Then this normal saline is mixed with bacterial colony with the help of wire. Then after that, prepare the smear, oval or round shape smear like this. Okay. Then after that, air dry the smear followed by heat fix. Then this slide shows principle of gram stain. Principle of gram stain is based upon various theory. Number one is PS theory. Number second is magnesium ion theory. This PS theory, that's based PS theory that tells about this gram positive bacteria. Protoplasm of gram positive bacteria is more acidic than gram negative bacteria. That's why this gram positive bacteria retain color of crystal violet. Then number second is magnesium ion. This gram positive bacteria, GPC stands for gram positive bacteria, not gram positive cocci, you can say gram positive bacteria, that consisting of magnesium ribonucleated, that magnesium ribonucleate retain color of crystal violet in gram positive bacteria. Then next theory is cell wall theory. Cell wall theory that tells about that is very important theory for gram stain. This crystal violet. Then we all know this. There is use of crystal violet. This crystal violet is positively charged. Okay, and it consisting of phenol compound. Okay, that interact with negative component of bacteria. Okay, negative component of bacteria. Once we put crystal violet on the smear, okay, this crystal violet phenolic compound of crystal violet that help this crystal violet to get enter into the cytoplasm of bacteria. Once this crystal violet get enter into the cytoplasm of bacteria, then this positive charge crystal violet that combines with negative constituent of this bacterial component. Okay, then after that we put grams iodine. Then this grams iodine that combines with this crystal violet, that leads to formation of CBI complex. CB stand for crystal violet and I stand for iodine complex. So CBI complex, crystal violet iodine complex. This crystal violet iodine complex retain in gram positive bacteria and removed out in case of gram negative bacteria, as the layer of this lipid layer of this gram negative bacteria get dissolved by the action of acetone. So let's see what all these things are happens. So once we put crystal violet on this smear, then as we all know, this crystal violet consisting of phenolic compounds. Then this crystal violets get enter into all this both bacteria, gram positive and gram negative bacteria. Okay, once this crystal violet get enter into this bacteria, okay, then crystal violet is negatively charged. It combines with sorry, crystal violet is positively charged. It's combined with negative constituent of bacteria. Okay, then after that we need to put grams iodine. Then this grams iodine, okay, grams iodine, this combines with this crystal violets, and that result in formation of crystal violet iodine complex, that is CBI complex. And this complex is very larger complex that not easily removed from this pore size of bacteria. Okay, then once you put ethanol or ethyl alcohol or acetone, then what happened in that? As you all know, what happened in acetone step? This, in case of gram positive bacteria, as you all know, this gram positive bacteria consisting of very thick layer of gram peptidoglycan. Once you put acetone or ethanol, what happens? There's shrinking of this peptidoglycan layers, and due to this shrinking, this pore size of gram positive bacteria is get decreased. Then once this pore size is get decreased, this crystal violet iodine complex do not get removed outside from the cytoplasm of gram negative bacteria. Then what happened with this gram negative bacteria? Okay, this, as you all know, that this gram negative bacteria that consisting of thin layer of peptidoglycan layer, and above this peptidoglycan layer there is a lipopolysaccharides layer, lipids layer, that is lipids layer. LPS stand for lipopolysaccharides layer, that is lipid layers. Then once you put ethyl alcohol or ethanol on this glass slide, then what happens? This lipid layers of this gram negative bacteria is get dissolved due to this action of alcohol. Remember, always remember one thing, lipid is always soluble in alcohol. Okay, once this lipid layer is get dissolved due to the action of acetone, okay, this pore size of this gram negative bacteria is increased, get too much increased, and CBI complex, this is crystal violet iodine complex, is easily removed from the cytoplasm of bacteria. Okay, cytoplasm of bacteria. Then once we put the saffron in, this which bacteria is get decolorized? Gram negative bacteria is get decolorized. So it takes color of saffronin, that is pink in color, and gram positive bacteria do not takes color of saffronin, as it is already takes color of crystal violet iodine complex. Remember one thing, this gram negative bacteria takes color of saffronin, as the CBI complex is removed out from this cytoplasm of gram negative bacteria due to this action of acetone, Then in case of gram negative positive bacteria, this CBI complex do not remove from the cytoplasm of bacteria, as there is due to the shrinking of this peptidoglycan layer of this gram positive bacteria, and due to the shrinking, this there is decrease in pore size of gram positive bacteria, and that's why the CBI complex do not get removed out from the cytoplasm of bacteria, and it do not takes color of saffronin. So this slide shows modification of gram stain. If there are different modifications of gram stain, number one is Koplev's and Bierschmann modifications. In this modifications, primary stain is used as a methylene blue, and counter stain is used as a basic fusin. Then Jensen's modifications, absolute alcohol used as a declaration and neutral rate is used as a counter stain. And this is mainly used for the meningococci and gorgonococci. Then writer's modifications, aniline xylol used as a declarizer and it is mainly used to stain the tissue sections. Okay. Then Preston's and Morley's modifications. In this modification, iodine acetone used as a declarizer. Then this slide tells about the limitations of gram stains. There are the certain limitations of gram stains. Okay, suppose if gram stain required very high concentration of bacteria to observe under this microscope. If the organism load is very less in the samples, if the organism load is very less, then you cannot observe organism properly by the gram stain under microscopes. This gram stain cannot give good result under this following conditions. Cell wall damage due to the antibiotics. If the patient come to your clinic, okay, and you recommend antibiotics to the patients, then after recommendation of antibiotics, you collect samples and send to the laboratory for this gram stain. Then due to the action of antibiotics, the cell wall of bacteria is get damaged, okay, and it is very difficult to absorb under the gram stain. That's why it is always recommended that samples should be collected before recommendation of antibiotics. And if you overheat the smear, that also leads to damage the cell wall and it is very difficult to observe organism under the microscope. Okay, then use of old culture. If the bacterial culture is too old, that also leads to loss of the cell wall. Okay, loss of cell wall, and in that case it is very difficult to observe under microscope. Then thickness of a smear is also matters in gram stain. If the smear is too thin, then it is easily decolorized by this action of acetone, and in that case, this gram positive bacteria that looks like gram negative bacteria. If thickness is too high, then it requires very more time to declarize. Okay, then if the iodine is too old, if the iodine is too old, that in that case this function of iodine, efficacy of iodine is not properly working, and that not properly combined with crystal violet, and that result in do not formation of CBI complex. If you over declarize this smear, in that case this gram positive bacteria that's become gram negative bacteria. So thank you very much. That's all about gram staining. Hope all of you understand about this thing.